I'm looking forward to having my first basically proper job, so the consistency of work and shifts, and probably meeting new people, getting the chance to learn from others. I've always found that doing my placements, I learned most while I was on the floor, so I'm really excited to see what 4 to 6 months worth of that brings me, and how much more I can learn in the short space of time.
Working in an area that I've only dreamt about. So it's been a goal of mine ever since I started nursing about 6 years ago to work in an acute environment, and ED's been top of the list. So definitely looking forward to that. Incredibly nervous that I'll stuff up or I'll be out of my depth or I'll make a mistake. But really looking forward to working in that environment, that high pace, being really busy, being able to draw on knowledge that I've learnt and put it into practice. Really looking forward to that. What else? Feeling more proficient in my job and confident. I suppose there's a massive fear factor now before I start, but I'm looking forward to that fear to start to dissipate, and yeah, I think it just comes down to confidence and knowing that I can be the nurse I want to be.
So I'm looking forward to being independent, being able to make my own decisions and do my own thing, because usually you're fine with nurses. Sometimes you want to do something differently. I'm looking forward to starting full-time work and that new challenge, especially you now have to do a lot more, as well as the learning side of things. There's a lot more to learn. You can learn a lot more on your own, and you have to do things a lot harder.
So I'm looking forward to really building up confidence and getting the hang of it. I know I have to sort of get there first, but I think I'll be really happy once that happens. Another thing I'm looking forward to is getting to meet everyone. My first rotation's at Upton House, so I'm really looking forward to getting to know everyone there. And the last thing I'm really looking forward to, I think, is just being a really autonomous practitioner and having some independence and stuff like that, even though I'm just a grad, so still working within my scope, but having a bit of freedom.
Independence. Being able to give that patient paracetamol and not having to make sure it's right. You know it's right. Also, I'm on a renal ward, so I've never actually been on a renal endocrine ward, so I'm really excited. That's going to be a really big learning curve. And meeting all the other nurses, especially my preceptor. I've heard that 8.1, the ward that I'm on, is amazing and everyone is lovely, and I can't wait to be a big community with them and go through day by day.
Definitely one big thing that makes me nervous at the moment is coming from South Australia and being an interstate student. I'm really concerned about having to learn about new documentation and the possibility of different policies and things like that. So I'm hoping that my fellow ward people give me a little bit of leeway there, because I'll have to do a bit more learning. I'm nervous about the obvious making a mistake. I know that it's normal for people to make mistakes, but as a junior, I'm just hoping that it's not anything too drastic.
Something I'm afraid of or not so much looking forward to, adjusting to night shift, which is fine once you're in the swing of it, but it's not fun. And perhaps not so much having the freedom to do what I want to do when I want to do it. So social life has to take a back seat for a bit, but that's totally fine.
Again, being independent, now you have to make your own decisions, and you're going to question yourself a lot. Nervous also probably about shift work. Now you sort of have to, your life is a bit different to your friends and things like that who definitely don't do this kind of work. And also nervous about making the decisions, and thinking that's the right thing and having faith in yourself as well.
Well, the first thing that comes to mind is my first day and showing up to the unit and not knowing where anything is or knowing who anyone is. But I hear that they're very supportive and hopefully they will notice how lost I look and give me a hand. So another thing, I think I'm scared to death of making a medication error, but we've been given like tools to help us with that, like the pharmacology learning package and stuff like that. So, and I think just to take it slow, so hopefully that won't happen.
Being independent, not having someone looking over your shoulder every 5 seconds and asking you questions about what you're doing. You really have to be active and think about everything you're doing, so I'm really nervous for that. What else am I nervous for? Hoping the patients like me and that I'm giving them enough attention, not just being really task oriented and actually showing them that compassion. I feel is going to be a challenge because you're going to be thinking so hard about all the technical things that you have to do. So that'll be another one.